Join me as I dive into the confusing world of Medicare and Medicaid to see if they really cover senior living costs in 2024. As we age, many of us will face the daunting task of navigating the complex world of senior living. With so many options available, from assisted living to memory care, it's easy to get overwhelmed. But one of the biggest questions on everyone's mind is, can I afford it? And that's where Medicare and Medicaid come in. As two of the most prominent government-sponsored healthcare programs, it's natural to wonder, do they cover senior living costs? And if so, how? In this video, we're going to get to the bottom of it. There's a lot of confusion surrounding what Medicare and Medicaid actually cover when it comes to senior living expenses. Some people think they're interchangeable terms, while others believe they're completely separate programs. And then there are those who are convinced that one or both will cover all their senior living costs. But the truth is, it's not that simple. Medicare and Medicaid are two distinct programs with different purposes, eligibility criteria, and benefits. And when it comes to senior living, there are a lot of gray areas. One of the biggest misconceptions is that Medicare covers long-term care, such as assisted living or nursing home care. But the reality is, Medicare is primarily designed to cover medical expenses, like doctor visits, hospital stays, and prescription medications. It doesn't cover daily living expenses, like food, housing, or personal care. So, if you're relying solely on Medicare to cover your senior living costs, you might be in for a rude awakening. Another common misconception is that Medicaid is only for low-income individuals. While it's true that Medicaid is a needs-based program, it's not limited to those with low incomes. In fact, many seniors who require long-term care may qualify for Medicaid, regardless of their income level. However, the eligibility criteria can vary greatly from state to state, making it even more challenging to understand what's covered and what's not. Medicare and Medicaid are often discussed together, but they have distinct differences when it comes to senior living expenses. Medicare is a federal program that provides health insurance to seniors aged 65 and older, as well as some younger people with disabilities. It's divided into several parts, including Part A, which covers hospital stays, Part B, which covers medical expenses, and Part D, which covers prescription medications. Medicare Advantage plans, also known as Part C, offer an alternative to traditional Medicare. Medicaid, on the other hand, is a joint federal-state program that provides health coverage to low-income individuals, including seniors. While it's primarily designed to cover medical expenses, Medicaid also covers some long-term care services, like nursing home care and personal care services. However, the specific services covered vary from state to state, and eligibility criteria differ depending on the state and the type of service. One key insight that might surprise you is that Medicaid is often the primary payer for long-term care services, including assisted living and nursing home care. While Medicare might cover some medical expenses, Medicaid is more likely to cover the daily living expenses associated with senior living. This is especially important for seniors who require ongoing care, as Medicaid can help supplement their income and reduce their financial burden. However, it's essential to understand that Medicaid has strict eligibility criteria, and not everyone will qualify. Additionally, Medicaid has limitations on the types of services it covers, and some states have more restrictive policies than others. So, it's crucial to research the specific Medicaid policies in your state and plan accordingly. In summary, understanding Medicare and Medicaid is crucial for seniors and their families who are navigating the complex world of senior living. While Medicare primarily covers medical expenses, Medicaid is more likely to cover long-term care services, including assisted living and nursing home care. By grasping the differences between these two programs, seniors can better plan for their financial future and make informed decisions about their care. If you have any questions about Medicare, Medicaid, or senior living costs, please leave them in the comments below. And if you're looking for more information on senior financial planning, be sure to check out our other video on the topic. You are invited to subscribe to Camaraderie Health Agency LLC YouTube channel or www.camaraderiehealthagency.com or 224-433-5754.